Good morning and thank you for joining us on Thriving on the Suncoast. There's a few things I want you to put on your calendar. Next week is National Rehabilitation Week. Health South has a full week packed full of interesting activities, educational opportunities. Starting this Monday, they're celebrating their 30th anniversary by having a ribbon cutting ceremony at 11:30, followed by a meeting with candidates who are running for office and tours of the complex. There'll be numerous superhero-themed activities all week with lots of fun games, quizzes, movies, and presentations. The festivities will end on Friday with a classic car show at 6 p.m., complete with food, music, prizes. Give them a call for a complete schedule. Also, I want you to know Comfort Keepers has officially started our Senior Hunger Food Drive again this year in cooperation with All Faiths Food Bank to collect food for needy seniors. Some of the donation sites are at libraries, chambers of commerces, Davidson Drugs, UFIT, and at our office, Comfort Keepers on Weber. So give us a call, 921-4747, for a pickup location nearest you, or if you need some help getting the food picked up. Today, we're going to discuss memory issues, dementia, Alzheimer's, and the role of Sarasota Memorial's Memory Disorder Clinic. I'm really honored to have here with us today Dr. Alan Grindal. Dr. Grindal is a board-certified neurologist with over 38 years of experience practicing in Sarasota and has been repeatedly selected as one of the best doctors in America by his peers. He is a fellow of the American Academy of Neurology and the American Heart Association. He's been an assistant professor at the Medical College of Virginia, and he's currently a clinical faculty at the Florida State University in Sarasota, and currently the interim director of the Sarasota Memorial's Memory Disorder Clinic. Also joining us today is Danielle Valery. Danielle has held many positions focused on protecting and serving the senior elder community. Today she's been appointed, or recently she's been appointed as a manager of the Memory Disorder Clinic at SMH. Thank you both for joining me today. I'm really excited to have you here. Danielle, tell us a little bit about the Memory Disorder Clinic.
Thank you, Michael, for having me. So at Sarasota Memorial Memory Disorder Clinic, we help people diagnose memory and mild cognitive impairment, Alzheimer's disease. It's a diagnostic clinic. It's funded partially by Sarasota Memorial Hospital, as well as a grant through the state of Florida called the ADI, the Alzheimer's Disease Initiative. So at our clinic, we treat people, we screen people, or diagnose people rather, with early mild cognitive impairment or other related disorders.
And you're over by the hospital?
We are located just on the hospital campus in an office building. It's 1515 South Osprey Avenue.
So how does somebody get an appointment there? Do they need to be referred in?
You don't necessarily need a referral, although we do get a lot of physicians or primary care physicians that do refer. You can be self-referred, a family can call, but yes, you would call the clinic, you can come for a free screening, and from that we can start the process to see if you need further testing.
How long have you guys been doing it? You've been in town for a long time, and I mean a really important aspect of the entryway into understanding memory issues in this community.
Right. So the program was started, this Memory Disorder Clinic was one of the last of 15 to open up in the state of Florida. As I said, it's through the Department of Elder Affairs, through the Alzheimer's Disease Initiative. So the purpose is to get the research and data to collect so that we opened in 2002 because they knew that Dr. Robinson back in the day, who was the geriatrician, felt that there was an important need in our community for these services.
Well, it is an important need, and you guys do an amazing job. Dr. Grindal, I'm so happy to have you here. I've heard some of your talks and really appreciate, the simplicity that you bring to a very complicated subject. Can you give us a little definition or oversight as to the difference between memory problems, Alzheimer's, and dementia?
Good. Yeah, I think this is the most frequent question we're asked, and I think it's important to look at really two things. When we look at memory problems and we look at dementia, we're looking at a spectrum of function so that people who have mild memory problems, perhaps forgetting a name, have a very mild functional problem. Individuals who go through mild cognitive impairment and then subsequently dementia, when one reaches the dementia stage, these are individuals who are no longer able to carry out their daily activities and need some assistance. Alzheimer's disease is a pathologic process. It is a disease of the brain that leads to these changes of cognitive function over time. So one is a measure of function. Dementia talks about a function. Alzheimer's disease is the pathology in the brain.
So people that have some forgetfulness, forget where they leave their keys and so forth, but then can't remember what they had for dinner last night. I mean, where do you draw the line as to determining whether, it's just a simple confusion or too much on your mind versus a more serious issue?
I think that's a difficult question because some of the same symptoms may occur in people with very mild issues and people with more serious issues. I think with regard to memory, forgetting names, forgetting the name of a restaurant, a proper name is not terribly uncommon. I think one of the early signs that we're most concerned about is when people become very repetitious. They ask the same question repeatedly over time or tell the same story multiple times in a day. So having dementia is not something that happens overnight. It is a gradual process, and so it's difficult to know where to draw the line. To me, the most important thing is if the individual or their family is concerned that there's been a change, then they should be evaluated. Sometimes we don't find any problems. Sometimes we find that there is some early issues going on.
So if somebody wanted to come to the Memory Disorder Clinic, Danielle, how are the services covered and what is the process?
Well, the process would be to either come for a screening or come for an initial appointment. We take most insurance and we also bill Medicare for our services, but if there's truly an indigent client, we don't turn away business. They would contact me directly and we make arrangements since we are a grant-funded program. So like I said, the main process is just contacting us because we have the resources to be able to assist in that.
So you mentioned that there's some funding, but obviously there's never enough funding. Can people help donate to the clinic?
Absolutely. They can donate through the Sarasota Memorial Foundation. Okay. You can designate for the Memory Disorder Clinic.
Got it. We're going to go to break right now. We get back, we'll hear more about the Memory Disorder Clinic. Stay with us.
Is Mom really taking her medications?
A Comfort Keeper can ensure that your loved one gets their medications on time, providing peace of mind for families in need of flexible in-home care. Comfort Keepers, let our family take care of yours.
When a stroke or injury impacts your life, we're here to help you get it back. With our dedicated team of specialists, personalized treatment plans, the most inventive technologies, and a coordinated approach to recovery. This is more than just rehabilitation. This is a higher level of care.
I enjoy my active senior life, so feeling good and staying fit is important to me, but I wasn't comfortable joining a gym.
So my friends insisted that I would like physical fitness. A healthcare professional analyzed my body needs and developed a fitness program exclusively for me.
Join this week and your initial fee is waived. That's a savings of $99.
Love your life even more.
Call Physical Fitness today for your personalized medically based fitness program.
I'm Rob Wyatt, and I've been offering reverse mortgages in the state of Florida for over 21 years. If you are 62 or older, a reverse mortgage can allow you to access your home equity while staying in the comforts of your own home with no repayment obligations for the rest of your life. And you remain on title. Call us to learn how a reverse mortgage can provide you additional tax-free income to enjoy life now and create a peace of mind retirement for your future.
Comfort Keepers can provide a variety of in-home services for your aging loved ones. We'll assess their needs and create a custom care plan that can change as their needs change.
Comfort Keepers, keeping the comfort of home.
The Harvey Center for Integrative Medicine is helping people every day to thrive and live healthy, vital lives. Our integrative approach combines conventional medicine with holistic and innovative therapies to help you achieve optimal function. Are you ready to function at 100% of your ability? Dr. Fred Harvey customizes tools and treatments to achieve optimal wellness at any age.
Hi, I'm Dr. Fred Harvey. Do you want to feel vital, vibrant, and fully energized? If so, call our office to find out how.
Welcome back. I'm here with Danielle Valery and Dr. Grindal from the Memory Disorder Clinic. Danielle, real quick, you mentioned grant funding. Tell us a little bit about the initiative and what it covers and what programs you have for that.
Sure. So basically, the ADI, the Alzheimer's Disease Initiative grant, for our program and our center for the Memory Disorder Clinic, we cover 3 counties. We cover Sarasota, Highlands, and DeSoto. We provide all the education necessary for caregivers. We have support groups and things of that nature for people caring for people with dementia and Alzheimer's, as well as providers, physicians. But also under that grant are 2 very important programs. One of them is the Silver Alert program. And that's when a person gets lost driving in a car, just like similar to the Amber Alert when a child is abducted. Right. And the other part of the program is making recommendations to the Florida Brain Bank.
Dr. Grindal, can you give us an understanding of what tests are used to diagnose how severe the problem is and what people can do about it, and maybe the process that is taken when you go through the Memory Disorder Clinic for an evaluation?
Okay, good. Well, first of all, as far as the process itself, like many evaluations for medical problems, we take a history, we do some preliminary testing, a quick screening of cognitive function. We do a physical exam, and then we do a series of diagnostic studies. It might be helpful to say what we do now and where maybe we will be going in the future. I think what we try to do now is to use the diagnostic techniques that are available to us. We feel that everybody should have some kind of a scan of their brain. The pathology is in the brain to cause memory problems. So we like to be sure, first of all, that there isn't some more serious problem. We've seen brain tumors, we've seen large strokes that had not been detected. In addition to that, we want to get some idea about the size of the brain. Is it appropriate for their age? Are there vascular changes? Have they had small strokes? And then, in addition to that, we do detailed neuropsychologic testing. That is, people are tested based on what their expectations would be relative to their age and education. So that's what we're doing now. I think where we're going in the future is to be able to better identify the pathologic process in the brain. And we have some new scanning techniques, the PET scan, which is going to be very useful in this regard, where we can actually find ways of detecting the pathology, the Alzheimer's pathology in the brain. And some of the new techniques will be able to get us a much better idea of what's happening within the brain itself.
What are some of the other related diseases that fall in the dementia category, and what kind of problems do they cause?
Good. Well, I think that, first of all, there is a tendency to equate dementia with Alzheimer's, and the reason for that, it is clearly the most common cause of dementia. So that's why there's this tendency to equate the 2 terms. There are several other causes. We see a lot of vascular disease, people who have had multiple strokes. Also, people who have had chronic high blood pressure, for example, may develop changes in their brain due to these changes. We also see Parkinson's patients and a variant of Parkinson's disease known as Lewy body disease, another cause of dementia. And perhaps one of the most unusual ones is something called frontotemporal dementia, where the changes are not necessarily memory, but are often the development of very bizarre behavior patterns. So we do see a spectrum of changes, Alzheimer's being the most common.
Do you see a causal effect with somebody who has Parkinson's turning into some type of Alzheimer's or dementia-related problems? They seem to go hand in hand a lot of times.
With Parkinson's disease, people who have had Parkinson's disease, particularly for a period of time, have a higher risk, a significantly higher risk of developing dementia. There is a type of Parkinson's disease known as Lewy body disease, in which the cognitive problems and the Parkinson's symptoms tend to occur at the same time. It's probably part of the same pathology, just a little bit different variant. But yes, unfortunately, people with Parkinson's disease are at increased risk of developing dementia. They also are at increased risk of developing Alzheimer's disease. So often we use these categories, but very frequently people don't just have one cause, they have more than one cause. The reason is most of these are related to aging. Most degenerative disease are age-related, hence they tend to occur together frequently.
So if somebody goes through this process and they get this evaluation from the Memory Disorder Clinic, Danielle, what happens next? Let's say somebody has some beginning stage of, Alzheimer's problems. What kind of help are you able to give them?
Well, what we really focus on is getting the diagnosis, establishing that relationship, and providing them with the resources, because now you have this information, but you don't know what to do with it.
Right.
A lot of our service also communicates to the primary care physician so that they know our recommendations for treatment. There's medications and things like that. Our physicians might be more up to speed on what's out there that might assist in those kinds of recommendations. So that and the services, and partnering with our other agencies in the area, the Friendship Centers, Alzheimer's Association, and what those services offer for the community, for the
Does somebody who
patients.
go through your process come back at a certain period of time, or are they handed off to their primary care at that point?
Typically,
And do you recommend some follow-up at certain stages?
We do. It's a little bit of a mix because everybody's different, but in some cases we'll see them back in a year depending on where they are in that progression, if it's mild cognitive, and we want to kind of follow them through their progression if they progress. And for others, sometimes he might notice something on a scan, he'll give the PCP a call that kind of seemed out of or irregular for a situation. So it varies by patient, but yes, we do we have a team approach, and that's what we do for the final evaluation before we deliver the information and sit with the family to explain the services.
What are some of the biggest questions people have when they're going through this process that you feel like they can be helped with information-wise?
Okay. I think and I go back to your question to Danielle, one of the reasons we like to see people again is that we want to be able to judge their course, because what we recommend may really be dependent on what they present with at any given moment. The other thing I think most people are concerned about is, what does the future mean? What's going to happen down the line? And by retesting them at intervals, sometimes we can get a better idea of the kind of course they're following. Some people, unfortunately, have a rapidly deteriorating course. Others may go along with very mild cognitive impairment for years without any significant changes. So we like to be able to follow people so that we can give them updated advice as time goes on, and also to give them a better idea of what the future brings for them.
We have to go to our break right now. Stay with us. Hear more about Alzheimer's when we get back.
The Harvey Center for Integrative Medicine is helping people every day to thrive and live healthy, vital lives. Our integrative approach combines conventional medicine with holistic and innovative therapies to help you achieve optimal function. Are you ready to function at 100% of your ability? Dr. Fred Harvey customizes tools and treatments to achieve optimal wellness at any age.
Hi, I'm Dr. Fred Harvey. Do you want to feel vital, vibrant, and fully energized? If so, call our office to find out how.
With the help of Comfort Keepers, I'm keeping my mom healthy.
I'm keeping Dad on schedule.
I'm keeping my mom happy.
Comfort Keepers in-home professional caregivers can provide meal planning and preparation, health and wellness services, and personal care services through custom care plans that can change as needs change, so your aging loved ones can stay happy and healthy in their own home.
Comfort Keepers, keeping the comfort of home.
I'm Rob Wyatt, and I've been offering reverse mortgages in the state of Florida for over 21 years. If you are 62 or older, a reverse mortgage can allow you to access your home equity while staying in the comforts of your own home with no repayment obligations for the rest of your life. And you remain on title. Call us to learn how a reverse mortgage can provide you additional tax-free income to enjoy life now and create a peace of mind retirement for your future.
I enjoy my active senior life, so feeling good and staying fit is important to me, but I wasn't comfortable joining a gym.
So my friends insisted that I would like physical fitness. A healthcare professional analyzed my body needs and developed a fitness program exclusively for me.
Join this week and your initial fee is waived. That's a savings of $99.
Love your life even more.
Call Physical Fitness today for your personalized medically based fitness program.
When a stroke or injury impacts your life, we're here to help you get it back. With our dedicated team of specialists, personalized treatment plans, the most inventive technologies, and a coordinated approach to recovery. This is more than just rehabilitation. This is a higher level of care.
Welcome back here with Dr. Grindal and Danielle Valery, Memory Disorder Clinic, Sarasota. Doc, this is a huge problem. Seems to be getting worse. You mentioned diagnostic testing. How soon should people get that?
Well, I think that this is an area of intense interest at the moment and some research. So I think it's difficult to come out with any strict principles at this time. But I think we find that the earlier that people's diagnosis is made, the better able they are to adjust their lifestyles, to anticipate future problems, unfortunately. We do have medications now, but the medications are symptomatic medicine. They help people's symptoms. They do not change the underlying disease. So one of the things we've wanted to emphasize was lifestyle, because lifestyle does make a difference. It reduces your risk of developing cognitive problems over time. And glad to go into some of those things
I
if you'd
think
like.
that's critical, because I've heard you talk on that. And look, if you notice there's a problem now, you need to, that's your wake-up call. Right. So you can wait around for a pill in the next 20, 30 years that may or may not work, or you can take action and try to minimize the effect of whatever the disease process is. And we know that people can heal themselves. It happens all the time, doing the right thing. So tell us a little bit about this. You know, you came up with about 8 items or something, right. I think, that I heard that I thought was really pertinent.
Yes, I think that, first of all, that the earlier you start, the better. So I think for lifestyle changes, the people who should start considering those are people in their 20s and 30s, perhaps before they're even a concern, because the lifestyle changes will have a greater impact the earlier one starts in life.
Yeah, I mean, you know, you don't all of a sudden have heart disease. You don't all of a sudden have dementia. You know, it builds up over time, so start taking the healthy road now.
That's correct. I think of all the factors that we have, exercise does seem to be the most effective. There is evidence now that people who do exercise, even on some of our recent studies, actually develop new brain nerve cells in the memory portions of their brain. So there is good evidence of that. That may be due to increasing the blood flow to the brain. There may be other aspects. Healthy diet, the Mediterranean diet is the one that's been generally recommended, is a second factor. The third, and I think very important, is to remain cognitively active. That is, to do things that stimulate your mind, not to the point of frustration, but to do something that you like to do, because if you like doing it, you'll keep doing it, whether that be puzzles or reading or taking classes. There's all kinds of ways. They even talk about learning new languages, a new musical instrument, various other things to do. We've talked about remaining social, very important. Humans are social beings. Isolation tends to create increasing difficulties, so people should be socially involved. And finally, we've talked about this issue of spirituality, which may come in all kinds of ways. It may be attending a church service, it may be prayer, it may be meditation, or even just taking a walk in the woods. Anything that tends to decrease stress, to make people relax, also seems to be effective. So I think good lifestyle is really what we have now. It makes a difference. The future, we may have medications. We really don't have any good, effective medications at the present time.
You know, that's great advice, I think. I don't think you can minimize how important diet is. You mentioned the Mediterranean diet. Maybe you can expand upon that a little bit, because we know that inflammation is the root of a lot of disease processes, and certainly if you're eating things that are causing an inflammatory situation in your body, you know, it can't be good for you. So you want to talk a little bit about the Mediterranean diet and what the research, because there's a lot of research now, isn't there?
I think it's helpful that the things that are healthy things to do, whether it be for your heart, is the same for your brain, because all the cells of the body kind of work by similar mechanisms. Mm-hmm. So with regard to the healthy diet, I think that we found a couple of things. One is to decrease the high glycemic content of your food. And with regard to carbohydrates, things that have a lot of sugar, like soft drinks, for example, would be detrimental. There was a recent study suggesting that seafood seems to be beneficial. Is it through the omega-3? Not entirely clear, but seafood seems to be a very important part of that diet. We also find that it's been said that things that grow in the ground are healthier than things on foot, on hoof to eat, and I think that that's another general recommendation. So the other thing that I think is important is that being overweight, obesity does have a very negative effect on cognitive function over time. So reducing calories, I think, is also important.
Are there some other disease processes that maybe diabetes, for example, that come from possibly not eating correctly that then flow into other problems of dementia?
Well, diabetes is an interesting one because we certainly know that diabetics have much more vascular changes, whether it be cardiovascular or cerebral vascular. It is a risk factor. There's also some interest now that the insulin may play a role in the function of our brain cells, and that there's even some talk and studies suggested of using insulin, intranasal insulin, as a possible treatment. I don't think we've got any good data on that yet, but certainly there is a strong tie to diabetes. Diabetes is a strong risk factor for dementia.
Danielle, how does somebody, if they're noticing problems with a loved one, what steps should they take to contact you?
Well, we do offer free screenings. Screenings are free throughout the community, plus at the Memory Disorder Clinic. But the biggest thing, like Dr. Grindal said, is when you start to notice these problems, the earlier that you can get screened and become part of this process, the better. Because once you know what the problem is, then you know what path to take to help that situation and get the services you need with us or our community partners.
Can't overstate what a wonderful job you guys have been doing for many years, and what you bring to the community and the support that you give the people that need this. So really give the Memory Disorder Clinic a call. I do want to mention a couple other things. Our senior food drive, please give us a call. If you know a location, we can put some food out because we really want to help raise as much funds as we can. Also, Dr. Fred Harvey, this Wednesday night, Ginger Lounge, 6 p.m. is doing a talk on vaccinations and what you need to know, whether they're right for you. And lastly, check out Comfort Keepers' Facebook page, our Good to Know segment, where we have amazing experts talking on unique and important topics that you're going to want to hear about. They're good to know. Thanks for watching. We'll see you again next week on Thriving on the Suncoast.
Comfort Keepers, Comfort Keepers, 'cause there's no place quite like home. Call Comfort Keepers.